This is a virtual event finishing today, and from next week, we start the in-person event in Geneva. We are going to run 2 more sessions there, so some of you might be there, and we look forward to seeing you in Geneva. Okay, so I will do the introduction bit. So my name is Nivedita Ray Bennett. I'm a professor of risk management based at the University of Leicester School of Business. Hideyuki Shiroshita and I founded the Avoidable Debts Network. And Hideyuki is also our speaker today. So what I will do today is that introduce Avoidable Debts Network briefly, if some of you don't know about ADN, Avoidable Debts Network. And I will also introduce a little bit about our International Awareness Day for Avoidable Debts. This entire month is our Global Campaign Month, and it just coincided, the UNOCHAS conference just coincided with our Global Campaign Month. So I'm going to take literally 5 minutes to tell you a little bit about our global campaign. But other than that, I'll pass it on to our chair, Asad Tahir, and he will lead the session for today. So as I said, this is our final session, and the session is called Debate on the Scope of Social Media During Crisis Communication, and it will be fantastic. I'm sure about it. So we can move on to the next slide. Just a housekeeping rule. Number 1, please, switch off or turn off your microphone so that it's muted, so that the speakers don't get disturbed by the background noise. That would be fantastic. Thank you very much. If you have any comments, questions, please drop it on the chat box. We have a chat manager. They are keeping an eye on your chat, so you will not be ignored or left behind or, not looked into your comments. Everything has been taken care of. That will be fantastic. Drop it, and then we have a Q&A session, and we will take up your questions, and our speakers will be able to answer them. This session is going to be recorded. If you do not want to show your face, please switch off your camera. You're most welcome to do that. Each session is timed. This is a 60-minute session, and we will finish it on time. And we will have a group photo just after my presentation. If you do not wish to be on the camera, please, you're most welcome to turn off your camera. That's not a problem at all. And as I said, that it's a 60-minute session, and each speaker will get about 10 to 15 minutes, and you will be reminded literally 2 minutes before that, the amount of time that is left. So we can move to the next slide. So this is the line of our speaker. So first is our Asad Tahir. He is the chair. He is the session lead. He organized this session. So he will provide a welcome address. I will welcome him after my presentation. Our first speaker is Dr. Athar Massour from University of Cambridge. And our second speaker is Asad. Asad will come back again. And our third speaker is Dr. Hideyuki Shiroshita from Kansai University in Japan. It's a slight change in the speakers lineup. We had Dr. Christian Morgner and Paul Riley. Unfortunately, due to some challenges at our end, due to the time differences, things were a little bit messed up. So we apologize for that. I apologize for that. But we do have some excellent speakers lined up, and I'm sure it will be extremely enriching and impactful this session. And the last part is a Q&A, and the concluding remarks will be done by our Asad Tahir. So we can move to the next slide, please. We can go straight to the second slide, Kelly, about Avoidable Debts Network. So a little bit about Avoidable Debts Network, or ADN. It was launched on 12th March 2019 by Hideyuki Shiroshita and myself at the 4th Global Summit of the Disaster Risk Institutes at Kyoto University in Japan. ADN is a global local membership network of experts, practitioners, researchers, and also passionate citizens interested in avoiding human debts from natural hazards, naturally triggered technological hazards, and human-made hazards in low and middle-income countries. We also work in high-income countries. I'm based in the UK. Hideyuki is based in Japan. And we also have regional coordinators based in Canada. So we do work in high-income countries. We have more than 1,000 members across 94 countries. And ADN exists to help policymakers, practitioners, researchers, and at-risk and high-risk vulnerable populations to make better decisions to save lives and reduce injuries to achieve sustainable development. We understand avoidable deaths as premature deaths, and those could be avoided through preventable, treatable, and risk governance measures. We can move to the next slide. This is a little bit about our International Awareness Day for Avoidable Deaths, or the global campaign. So we can move to the next slide, please. So on 12th March 2023, literally 2 years ago, we launched the International Awareness Day for Avoidable Deaths in the city of Izumiotsu in collaboration with the city mayor called Minamide Kenichi. You could see on the right-hand side on the top. And the global campaign was headlined at the time by then United Nations Disaster Risk Reduction head, Ms. Mami Mizutore. The global campaign is celebrated globally. This year is our 2nd year. And we invite you, I know we still have some time this month, about 9 days. We invite you to celebrate this day or raise awareness about Avoidable Deaths Day, wherever you are. So if you can't celebrate this year, we welcome you to celebrate it next year. And we have a dedicated website. You can find out more about our global campaign. This global campaign is a 10-year campaign for us. And the 11th year, we will drop the word awareness. We hope that by 10 years' time, we will be able to raise awareness about avoidable deaths, and then we will call it International Day for Avoidable Deaths. As I mentioned that our members are spread across 94 countries, it's very difficult, the time differences, different time zones, so we celebrate the global campaign throughout the month of March. So we are receiving lots of photos and events. So if you have time, if you follow ADN, you will be able to see some of the updates. We can move to the next slide. So the purpose of our global campaign is basically fourfold. I know there's a little typo on the slide. It's fourfold. So first is to raise the visibility of disaster deaths, especially indirect disaster deaths and missing persons. Second, our aim is also to increase the visibility of the causes and circumstances that lead to disaster deaths so that context-specific interventions can be put in place to save lives. Our third aim is to promote the slogan, disaster deaths are avoidable, and they're avoidable through preventable, treatable, and risk governance measures. And you could see on the right-hand side our figure. We call it Avoidable Disaster Deaths Framework or Avoidable Disaster Deaths Approach. And this approach, in a way, underpins all our activities that we do. And the fourth reasons why we celebrate the global campaign is to value the lives saved and reflect on the achievements of saving lives. So this year, we introduced a new award called ADN Hero Award, where passionate citizens can come up with some frugal innovations to save lives. And there was one such person from Pakistan, and her name is Tahira Khan. She came up with a really low budget, frugal innovation to save lives from well fall. So this year, the award has gone to Tahira Khan, and we will be distributing our awards on 31st of March, and you're most welcome to join the awards ceremony. And it's taking place at 2 o'clock on 31st of March. We can move to the next slide, please. So this year theme is do one thing, literally one thing. It can be anything. Could be a rally, could be launching a report, launching a book, writing a press, taking out a rally. So there is no prescriptions. You could do anything that meets your context. And if you want more ideas, you can go up on our website called International Awareness Day for Avoidable Deaths, and you will find what the campaigners did last year. We can move to the next one. Just to help you with your global campaign activities, we have developed several cultural assets. They're available to be downloaded from our website free of cost. We have 13 key messages. You can cherry pick the key message that meets your context. We have a guidance for campaigners handbook that is also available. We have this graphic. You could use this. Disaster deaths are avoidable. We have 2 colors, blue and green. And we also encourage our campaigners to use the hashtag Avoidable Deaths Day. And we also have a toolkit. If you're interested, you'll have to drop us an email for this toolkit to understand the causes and circumstances of avoidable disaster deaths. We can move to the next one. Why is it important to reduce disaster deaths? I think it is important because the vulnerability of the population mainly carries this burden of disaster deaths. And reducing disaster deaths also gained traction in 2015 when Sendai Framework launched the 7 global targets, and the first 2 global targets are about reducing disaster deaths by 2030, and the second target is to reduce the number of people affected by disasters by 2030. And these 2 targets work at the interface with several sustainable development goals, 3, 9, 11, 16. You might find many more depending which avoidable deaths you are looking into. So this global campaign directly contributes to the Sendai targets and the Sustainable Development Goals. And ADN is also a member of the United Nations Sendai Framework's voluntary commitment, and our commitments are for these 2 targets, A and B. Furthermore, we believe that better understanding of the causes and circumstances of avoidable disaster deaths can catalyze systemic change at national and local levels. We can move to the next slide, please. This is my last slide. If you are not following ADN, you are most welcome to follow from today onwards. You can, visit our website. We are not very proactive on Twitter or Facebook, but we are proactive on LinkedIn. As you would know, that ADN is based at the University of Leicester and Kansai University. It's not a foundation, it's not a trust, it's not an NGO. It's run by our volunteers, especially volunteer students. So sometimes we are very proactive, sometimes we are not able to because our students would have some exams and so on and so forth. So yeah, but otherwise we are pretty proactive on LinkedIn. You can follow us through our IAD for AD as well. So I think with that note, I'm going to stop the introduction bit, and now we can start the webinar for this debate on the scope of social media during crisis communication. The first up is Asad Tahir. Asad has many identities. Many identities. He is a bestseller novelist in Pakistan. He's a very famous columnist for many newspapers in Pakistan, and also a father, wonderful father, But I think for us, Asad is our regional coordinator for Pakistan, and above all, he's our PhD student at the University of Leicester School of Business. I'm very proud of Asad, what he does. He basically came up with the idea for this session, and he is the chair, he is the host. So he will be running this session. So Asad, I invite you to start your webinar for UNHCR's Humanitarian Networks Partnerships Week's conference. So over to you, Asad.
Thank you very much, Dr. Nivedita, for the introduction, and also above all this opportunity that you've created at this platform for ADN and UNOCHA together to host this fantastic event today. And I also welcome our 2 speakers, Dr. Athar Mansoor, who is a research associate at Cambridge, and the co-founder for ADN, Dr. Hideyuki from Kansai University, Japan. In addition to the 2 speakers, I also welcome Callie and her crew who are managing our webinar, and also all the wonderful audience and the participants from, there are 92 by now. Just prior to the beginning of this session, we could see 92 amazing people from around the world who have joined us this afternoon. So welcome everybody. This session, basically, as you would have seen, is aimed at triggering an interesting debate around the role of social media, particularly during crisis communication, disasters, be they natural or man-made emergencies, public emergencies, as to how does this social media environment impact crisis communication endeavors, particularly at the leadership level, because every crisis puts leadership under spotlight. There are, of course, both sides to the debate. There are, in literature or relevant scholarship, there is evidence that, yes, social media has posed a wide array of challenges to communication in terms of disinformation, misinformation, and miscommunication. At the same time, there is evidence in literature that social media, if handled properly, if the social media platforms are leveraged, they could also be used to facilitate crisis communication. So we are going to have an interesting debate. And after including myself, the 3 speakers have spoken, I will have also some supplementary questions for the speakers, but after my questions, of course, we will open this session for the questions from the participants. So you're all welcome to join us in the last 15 to 20 minutes and ask your questions around this topic and add value to the debate that our learned speakers would generate. So with this quick, short introduction to this webinar, I would now introduce our first speaker and also give a bit of introduction as to Dr. Athar Mansoor, who is currently a research associate at University of Cambridge. Primarily, Dr. Athar is a civil servant and brings with him a wealth of experience as a policy practitioner, as a researcher for over 2 decades now. He has earned a master's from LUMS, a master's degree in management, and then prior to his earning his doctoral degree from Hong Kong, he had earned 3 masters from Australia, from Michigan State University, US, and National University of Singapore in public administration, public policy. Public policy and innovation remains his cutting edge area of specialty as a policy practitioner and researcher. He's a wonderful speaker. His research was again in leadership and innovations, innovative policy paradigms. He works extensively on his area of research. So with this short and quick introduction, I welcome Dr. Athar Mansoor to please share his informed insights on the subject.
Asad,
Right.
Dr. Athar, 1 second, if you don't mind. Can we have quick photo shoot? And then
Yeah, sure.
Sure.
Thank you very much. So Kelly, over to you.
I'll request all participants to please switch on their cameras and show their brightest light for a few seconds, just give time to our photo shoot. Thank you. Anushka, is it done?
Yes, it's done. Thank you.
Thank you all.
Over to you, Dr. Athar.
Thank you so much. Thank you, Dr. Nibita and Asad for giving me this opportunity to speak on this very important topic, which is very close to my heart. As you have mentioned, that I have had the opportunity of serving at different public service positions. And during my career, which spans almost 25 years, I have had the opportunity to tackle on behalf of the state and make decisions and communicate with the public in the times of crisis. And as it's important to understand that crises can be, like, as you have identified very rightly, they can be natural, they can be man-made. And I have had the opportunity to communicate with people on from both perspectives. In times of natural crises, yes, I got the opportunity to talk to people, to keep them calm, to keep them composed, and to respond in a manner which should not have those kinds of consequences for the society at large, which can have negative implications as such. And in the times of man-made crisis, also, I have had the opportunity to talk to people and communicate with them. The interesting thing is that this social media, for the last about 10 to 15 years, I would say around 15 years, has brought in a lot of opportunities as well as threats. So it is an enabler as well as an obstacle, which you have also rightly identified in terms of leadership communication during crises. And again, the crises can be natural as well as man-made. So this is really important to understand that the challenge, the opportunities it offers, or first I would go to the challenges first, because I think it's important to understand the challenges, and then we can see how the opportunities arise when using these tools for effective management of crises is there for the leaders to take into account. So I think the first and major and foremost challenge which I have had while communicating during times of crisis was the misinformation and disinformation, and at the speed which actually bewildered us as policy practitioners, the speed at which misinformation and disinformation spread through the social media. Because you see, social media is in the hands of everyone. Everyone who creates an account on social media, we do not have a kind of control over how people write or frame their messages or their posts or what they want to communicate or convey. So the first thing which we faced as a challenge in a developing country settings as leaders was that fake news, rumors, or conspiracy theories, they spread so rapidly that we were astonished, and we sometimes felt helpless to respond because the speed was massive. And I would quote the example of COVID-19 pandemic. So there were so many rumors about the treatment of the disease as such. People would come up with, in different parts of the country, would come up with their different remedies, and they would post them on the social media, and people would start following them. So as state functionaries, it was a challenge because we were, when the vaccines were introduced and we got a full batches of vaccines from abroad, we were worried that people would not get vaccinated because their scientifically tested treatment was I would say, scientifically tested preemptive prevention was the vaccine. It was professionally tested scientifically in the labs, but people would, by that time, we were fearing, would be taken, they would be overloaded with the information about rumors and fake news about treatment or preventing the disease. So what we faced as a challenge was to debunk the false narratives and so that they would not get amplified. This was our main challenge, and this we faced. Similarly, I think another challenge which we have faced in many crises is the information overload and noise. So in the world of social media, because there are so many, it can get flooded with news and your own points of views. People might struggle to get access to authentic kind of messages. And we have felt as leaders in our own positions, and we have talked about it extensively, that we felt that our message would be drowned in the noise, in the overload of information and noise. So this was the second message. Then the second challenge. The third challenge we have faced was the, I would say, emotional reactions and backlash. So for example, during the crisis communication, we need to understand that leaders who are in leadership positions and managing the crisis, they need to remain calm, they need to reassure the public, they need to bring out the factual things in front of the public. But the problem with social media, in this world of social media, where extensive social media is being used, that it thrives on very kind of emotional messages and outrageous messages. So these traits of social media, where outrageous and emotional messages get really spread fast, we felt that the emotional reactions and the backlash during the crisis would be hard to control. And lastly, I think what we faced was the privacy concerns and the cybersecurity threats as a big challenge for communicating with people, for making them understand that this is a crisis situation and we need to take it very seriously, and we need to get information from authentic sources. So there was a big number of we still face that fake accounts, then these bots which are being used by people, which are there, and then false crisis narratives which get spread through these fake accounts and hacked accounts, and the data breaches which we can face. So I think these 3 or 4 challenges, they can be real barriers to use of social media during crisis management from the perspective of leaders. Now coming to my next part is the how to leverage social media for effective management of crisis. So this is something which we need to understand, that the most important thing in this era where we live in information age, rather information overload age, is that as leaders, we must understand that we have to develop or we have to establish rather a connection of trust and credibility with our audience. For that, I think over a period of time, leaders develop their capital through verified accounts, through proper information spreading, through countering any false narratives or false or disinformation. And so leaders must use their verified official accounts. And then there is another important thing which leaders must take into account, and that is to keep the message consistent over different social media tools. So there are a number of social media platforms which leaders can use and use if they are using Twitter, Facebook, Insta, or LinkedIn. So the message should be consistent across all social media platforms. This builds credibility, this establishes trust, and we need to understand that this is very, very important. Then we move to the next important thing which leaders can leverage while using social media is the real-time information sharing and transparency. So real-time update of warnings, real-time update of emergencies, any safety measures led by the state, propagated by the state or encouraged by the state to adopt during the crisis situation, that those are very important. And we have to be very, very quick in updating things. Alerts should be sent very quickly so that because the uncertainty has to be removed. During crisis, the biggest risk is created by uncertainty, right? So the data coming to people, information coming to people, that creates uncertainty, and that has to be taken care of. And lastly, I think one more thing which is important is to engage directly with the public. So using live streams can be very helpful. For example, YouTube is a good way to use live streaming. Facebook you can use for live streaming, and these can be a good way to keep people updated, and then taking their questions, listening to them, trying to remove their apprehensions. This is an important and vital, significant thing, a step which leaders can take. Lastly, one more thing before I wrap up my part is that this is the world of AI and data, big data and data analytics. So leaders must try to use social media during crisis to track the trends of crisis, also monitor where public sentiment is going, in which direction public sentiment is going, and also to identify the patterns in misinformation. So identifying the patterns of disinformation and misinformation must be done through social media. So I think these are a few things which I wanted to share with the audience today in terms of enabling factors and in terms of challenges which we face in crisis situations. Thank you very much.
Thank you very much, Dr. Athar, for your valued and informed insights. In order to compensate for the time, I will shorten my contribution. As the session chair, I have to keep an eye on the time management as well. I will only pick up from where Dr. Athar has left about both the pros and cons of social media, and particularly during crisis communication, when stakes are very high. The first thing that crisis does, the relevant literature on the subject says that if you don't manage communication during crisis, it becomes crisis of communication. So we have to be very proactive. Then there is called crisis preparedness. There is a body of literature that suggests that organizations, both public and private, they should put in place a robust system of internal communication within the organization, because the first casualty during any crisis, be it natural or man-made or public emergency, is the panic from within the teams under their leader, be it a public organization or a private organization. So the robust and responsible and resilient internal communication system is of immense value. And those organizations who have done the homework, who are already prepared to deal with emergencies and crises, they are in robust and resilient, responsible and reliable internal communications. They always help. Another insight coming from literature is that communication is not only an ad hoc or proxy arrangement that has to be put in place during emergency or a crisis. It is a continuous exercise. And throughout the year, the organization, and particularly the organizational leadership, should, and the PR, the public relation and media wing of any organization, should find ways and means to constantly remain busy and engaged with media, mainstream media, as well as should leverage their own social media platform to engage with all the key stakeholders to inform the citizens about actions that they are taking. Their own media outreach should be robust, so that their relationship with the media and media platforms does come a handy solution when the need arises during a crisis situation. Furthermore, there is ample literature on the subject saying that it is since now a two-way communication. For the first time in human history, social media has given it a 360 paradigm shift. Prior to social media, it was only one-way communication, be it print or electronic. It was only a news item was produced, and on the other side of the fringes, the citizens or the consumers would consume whatever was being shared from electronic or print mainstream media. With this social media, now it is also being called as citizen media, because every person with an Android phone in his or her hand has become a producer of information, at the same time a consumer of information. Therefore, civil servants or leaders in their organizations can leverage social media efficiently, effectively, and making citizens as their eyes and ears, who are tagging them in their posts. If there is a intervention failure on the ground, let citizens be their eyes and ears. And actually, citizens are doing their job when they are telling the heads about any interventions which are not working, or an intervention which should have been put in place in any emergency or disaster. So thereby, it is time that social media, besides or in addition to its flip side and cons, its pros should also be leveraged, and organizations should find ways to not only bust fake news and disinformation, but also leverage social media platforms, their official social media platform, to work and engage social citizens as their important stakeholders, because eventually it is the citizens who are the first and foremost stakeholder to any organization. With this short and quick insight from my side, I now would go on to our third and last speaker, Dr. Hideyuki from Kansai University. Dr. Hideyuki also is one of the founder presidents of Avoidable Deaths Network. Dr. Hideyuki also brings in rich experience in both policy and practice around risk communication and disaster education. He has also chaired numerous committees on this area of subject at the governmental level in Japan. And also currently he is chairperson to Osaka Prefectural Committee on Community Safety and Risk Communication. With this short introduction, I would now invite our next speaker, Dr. Hideyuki himself, to please share his insights on the subject.
Okay, thank you very much. Thank you, Asad, and thank you all. My name is Hideyuki Shiroshita. I am one of the founding president of Avoidable Disease Network. Also, I am an associate professor at the Faculty of Societal Safety Sciences, Kansai University, Japan. So today I'm very happy to be here and have this opportunity to talk to you all. So today I am going to talk about disaster education in Japan for tackling black swans. So education is mainly for pre-crisis communication. That is usually called risk communication. Due to my knowledge limitation, I can only cover risk communication only today. But I believe risk communication relate crisis communication as well. So can I use my slide? Can I share my screen? Yes. Okay, from now on, I would like to use my the slide. Okay. For ADN, March is the month of global campaign, as Nivedita mentioned. That is International Awareness Day for Avoidable Disease. But for Japanese society, March is also the month of disaster risk reduction. So this is because we had a devastating earthquake and tsunami in 2011. Since the disaster was catastrophic, it has been described as an imaginable event, or what we call black swan. In Japanese, it is called Soteigai, meaning beyond expectations. So although it was considered a black swan, not everyone agreed with describing the disaster in this way. So if the event was purely a black swan, all people would have accepted the situation as unexpected. This means dealing with the situation would have been quite difficult, as precautionary measures are usually not taken. However, after the 2011 Tohoku earthquake, there have been many civil actions against the tsunami evacuation led by schools. So far, around 10 cases have reached the conclusion, and this does not include Fukushima nuclear power plant related case. In some cases, families won the case. So the situation after the 2011 Tohoku disaster shows that some people did not think the disaster was an unexpected event. Moreover, these legal outcomes have placed increasingly difficult safety standards on experts. So one of the most well-known cases is that of Okawa Elementary School in Miyagi Prefecture. Tragically, 74 students and 10 teachers lost their lives in the tsunami. It was the only school in the affected area where students under school supervision died due to the tsunami. This is an aerial photo of the school after the tsunami. So 23 bereaved families took civil action and won the case in 2019. The decision pointed out that the principals of elementary schools must possess a much higher level of disaster reduction knowledge and experience than local residents to ensure the safety of children. So although on the hazard risk map published before the 2011 earthquake and tsunami, Okawa Elementary School was located outside the tsunami inundation area. The court stated that the principal could have judged that tsunami damage was predictable based on the school's location. I believe this judgment was extremely tough on any school teacher in Japan. Hence, after the Tohoku earthquake, experts and practitioners have been trying to find the black swan in advance to avoid repeating these tragedies. However, it is theoretically impossible to find black swans in advance. This is simply because of its definition. Once we found it, it is no longer a black swan. So when we first encounter it, we call it a black swan. So a black swan is only recognized when it occurs for the first time. But this applies only to pure black swans. I think there are two types of black swans. One is pure black swans, which I mentioned. So future events that only God knows, or we can say that disaster reveals them. The other one is black swan in a silo. So there are regional black swans that outsiders can point out, but locals may overlook. But what we learned from the aftermath of 2011 disaster is that there are many perception gaps among stakeholders. For instance, in the case of Okawa Elementary School, the teachers and the education board thought it was a black swan. However, parents believed it was a white swan for teachers and the education board. The event should have been anticipated by school authorities. So perception gap among stakeholders, in other words, silos, in disaster risk reduction could lead to civil actions. So based on the lessons learned from past disasters, what is needed for disaster risk reduction education? In DRR education, it is necessary to unfix the relationship between DRR expert and lay person. In other words, we need to build a new relationship that can break down silos. This can also be applied to the relationship between teachers and students. Currently, most education follows a one-way knowledge transmission model. So teachers teach and students learn from teachers. To unfix this relationship, I have been implementing DRL education that aim to change the relationship between teacher and student in Osaka. So let me introduce Hama Elementary Schools. This is an elementary school in Izumo City where we launch our global campaign that is in Osaka Prefecture. So the project target age group is 5th grade, that is 10 to 11 years old students. The DRL education program has been running since 2013, so more than 10 years history. We have tried to realize mutual learning between teachers, in other words, experts and students. This is the location of Hama Elementary School. The school is near the sea, very close to the sea. Well, why is this school so engaged in DRR? The reason is if the expected Nankai Trough earthquake happens, they will experience Japan Meteorological Agency seismic intensity scale 6-. This is the third strongest out of 10. A large tsunami, maximum height of 4.4 meters will strike. The tsunami will hit the city 95 minutes after the quake. So this is the situation they have. There is also a damage estimation by the prefectural government. If the expected tsunami hit the city, around 2,000 people could die. But if one condition changes, that is awareness of the importance of evacuation, no one would need to die due to the tsunami. In other words, if the residents of Izumo understand the importance of the tsunami evacuation, then no one would die from the tsunami. Hama Elementary School focuses on this crucial point. So to disseminate this important information to the public, pupils are working on many projects. So this is the list of the projects. The most recent one is a short movie. So students made 1 minute long video to spread the information they think is important. So some pupils created a video of evacuation route, others explained evacuation go-backs. All pupils thought about how to ensure smooth evacuation in the city. So let me show one example. So this group of people did an interview with the city officer in charge of DRR regarding evacuation shelter and goods prepared by the local government.
Hideki, there is no sound.
Sorry?
There is no sound. Is it supposed to be?
All right, okay. Right. Aha. Okay. Much for putting out. Yes.
ここが浜小学校の防災倉庫か。よし、行ってみよう。これが防災倉庫の中身か。ここのラップ盆って何ですか？
ラップ盆というのは自動ラップ式のトイレといって、非常用災害のあった時に、トイレきれいに使うために一回一回のおしっことかをラップをしてビニールの中に閉じ込めて圧着して使うトイレです。
なるほど。この段ボールの中全部食料なんです。食料や
Okay.
ここが浜小学校。
Yeah, let me stop. So yeah, of course, student projects are great, but I found from the project that having students teach something to teachers or experts is not easy. So there is a big gap in knowledge and skills between students and teachers. So there, yeah, to realize this arrow is not easy, but this is important to to break down the silos. So I think we should change the idea of understanding of the project. So to appreciate the project, I think it is important to evaluate its impact not only experts and teachers but also on others. So if pupils, children can increase the level of knowledge or awareness among residents in the city, their activity should be evaluated as a success in breaking down silos. So yeah, I think to anyone, students should teach about disaster risk reduction, and this will, I hope, break down the silos among the stakeholders. Okay. Yeah, thank you very much. Thank you.
Thank you, Dr. Hideyuki, for your informed insights on the subject. Now, as promised, we open this debate for questions from the audience, please. Anyone from the audience who wants to raise question can unmute the mic and ask the question. Or you can type your question in the chat box. Yes, please. Godwin.
Hello, my name is Godwin Ondoma Oga. I live in Finland. I'm studying global health and crisis management at Masters at Laurea, University of Applied Sciences. Thank you so much for your great presentations. It was very informative. I've been taking so much notes. One question I have is in terms of a crisis or a disaster preparedness, how do you communicate? How do you ensure that the right communication goes out before the negative communication? How's it possible to counter that? Because as soon as a disaster strikes, there's always communication. Everybody has a right to their phones and their devices, so they go up and type how they feel about the disaster without getting the right and informed information on that disaster. So what are the ways to mitigate this or to get the right information to overshadow the false information, and how fast can it be done? Thank you.
Probably your question relates to my share of the discussion, because I was talking of crisis preparedness and communication preparedness. That is what the literature suggests, and that's what me and Dr. Atta, as a practitioner in the public sector, we came across situations. We handled those emergencies and crisis situations. And that is also about preparedness, because, you know, in every organization, you need to identify and you need to have focal persons. You need to nominate persons who would talk to media. There are mock drills. There are always contingency plans ready. There are lines of communications put in place. You always know as to who will reach media, mainstream media, and who will handle your own internal social media platforms, for example. You have contingencies ready. You are prepared fully, and you develop the handout. You develop a tweet, and you are the ones to leverage your social media there and then. The accurate, correct situation on the ground. Now, there could be three situations. There could be three ways of doing it. If there is a misinformation going on, you need to rebut. You need to use your Twitter and the other social media handles to immediately rebut that the news being circulated is absolutely flawed, malicious, and detached from facts. And for example, if there was a rumor that at X number of hours at night, there will be earthquake in the city, and it could, of course, cause huge uproar. Now, you could leverage as the district head of the city, you could bring in the Met department online. You could have them tweet, and you can retweet their tweet from your handle and say that there is not even the remotest possibility of any earthquake in the next year. So you can rebut through reliable, official, not only the relevant stakeholders, but also leverage your own platforms, social media platforms, to take charge of the situation. Because one thing is for sure, you don't have the luxury of time available. You don't have the luxury of shying away from the crisis, because if you don't communicate, someone else will, and they will communicate the way they think appropriate, and that will become a crisis of communication.
Right. Sorry, just to wrap it up. So I'm from Nigeria, and if you remember when the Ebola Ebola struck West Africa, overnight there was information, text messages on social media and saying that, you know, Ebola just struck, and the preventive measures to take immediately was for people to drink salt and bathe with it. This information went out from like 10 p.m. at night all the way into the morning. So people reached out to their relatives, friends, cousins. People started to drink salt, like raw salt, just put in water and drink and bathe with it. And there was a huge number of casualties, even before the virus, you know, had hit. So it's part of what informed my question.
Absolutely, yeah.
Thank you.
Anybody next to Godwin, please? Is there any question in the chat box, Kelly?
Asad, I have a question.
All right.
Yeah, the question is back to Godwin again. So, Godwin, if that was the situation, how did the Ministry of Health or the health department responded to that rumor?
So, so we're talking about proactive measures here. So this information came in at about 8 p.m. to 10 p.m. close of work. So I believe for some reason the government were not as proactive as they should be at the time. So it had escalated before the morning. You know, it's escalated through the night, and before the morning, when the right information started to come out from the Ministry of Health and you know, the public speakers and all of that, we already had casualties. There were already casualties. So they were not able to respond to this information at that time. It was a lot of chaos. And then before they could respond to it, you know, the damage had happened. So the timing at which the information really affected a lot of things. And I don't know what they would have done better at that time.
Yeah, just a follow-on question is that, I mean, were there any studies afterwards to find out the demography of those people who had carried the casualty or injuries?
Funny thing is, it cut across everybody, both people who are educated, both people from the remote areas, because so salt is a very significant property, especially for the African culture. So the cultural belief comes in here. Salt is very significant. So they believe that salt takes away diseases. You know, it's like it's a magic working element. So take the salt and it prevents you automatically, like a vaccine, from any type of disease that is about to hit. You know, so even doctors were found taking it, because older people who had knowledge of traditional medicine were calling to say, this is the right thing to do. Forget about the Western medication. Don't think about those things. You need to take the salt and bathe with it, and you would be protected. So it was not even just the affected people were not just the illiterates. It cut across everybody.
So that's Dr. Nivedita basically is quoted as a case study, Ebola pandemic and the failure of tackling the disinformation on the spot. It should have been the role of Ministry of Health to be proactive, to take measures to rebut, nullify the disinformation, and took to their, leveraging their own social media platform. They would have rather called a press conference, brought in electronic media, TV channels, and said, this is absolutely rubbish. There is no evidence or literature or research on the subject. And this use of salt might even do more harm than good. So this should have been the proactive measure, which the government didn't, and eventually it allowed the disinformation to take to rather have that collateral damage beyond proportion.
But do you think they would have been able to respond as fast as possible to have prevented this?
Why not? What there are case studies around pandemic, this COVID pandemic, as Dr. Athar has rightly pointed out. How about New Zealand? How about the New Zealand Prime Minister? There are many case studies at the country level, at the state heads, who were very, very, very proactive. They leveraged media on a war footing. Basically, this is a war on truth.
Yeah.
This social media unleashes a war on truth, a war on information through disinformation. So all the plans that you put in place during a war, you have to wage a war on disinformation.
Right.
And you have to take measures as if you were in a war, and war on disinformation, of course, involves all possible measures that are taken during a war to avert, to minimize collateral damage, to rebut, to clarify, and then come back with truthful, reliable, official version, which of course people believe, because people know that anything coming from state, coming from the relevant stakeholder, be it a Ministry of Health, top doctors speaking through that national media, this is rubbish, don't believe this. This is only fake and a hoax. Much damage could have been avoided.
I think there are two things happening here, though. If you put on the analytical hat on and also public health hat on, so what is interesting that disinformation can work very nicely if there is a cultural belief on certain things.
Yeah.
Do you understand what I mean? So
Yeah.
if the national governments and medical doctors also believe in the salt's property in that cultural context, the disinformation gains a huge fuel,
Right.
Absolutely.
huge momentum,
Right.
and huge traction. And that's what has happened probably. Of course, I didn't know about this incident before, but I'm just listening by being myself also a public health student at the moment.
I'm sure Dr.
It's
Athar would
interesting.
also share his 2 cents for 1 quick minute, please. Dr. Athar, if you were there as Secretary Health, in that situation, what would have you taken, the measures that you would have adopted?
I think the most important thing you have already identified, I just direct upon it, that it's the war on truth. So this is not metaphorically something which has to be taken. Because, in my discourse, I also tried to point out that, and you have asked it in your question also, that how can you stop someone? Everyone has access to his or her a mobile device, electronic platform, through laptop, through smartphone, through so many channels, right? So you cannot stop it. It's impossible to stop the information flowing in. The only thing which we need to do is to very quickly, as people in positions of power or position from which we can influence people, which are leadership positions, to respond it in a manner which seems professional, engaging, interactive, authentic. Because leaders have to speak authentically, right? Coming with authenticity and rebutting the information which is coming to you in a falsified manner is very important. So this is an extreme example which you have shared, and I'm very glad that you have shared with us, and it has added to our knowledge that how these real life stories unfold, how these real life crises unfold in different parts of the world, because every situation can be different. It has to be contextualized, it has to be understood in a manner, and then your design, and then your response strategy has to be designed according to the context in which it is operating, the socio-cultural conditions, the economic conditions, the overall awareness level of the people, how much the society accepts falsehood, how much the society accepts truth, and there's so many things. So people who are in positions from which position from where they can influence people, I think they need to take this everything into account. So as Secretary Health, as Mr. Asad has said, I would be really worried about telling people that yes, this is something you should not do. Salt, come on, why are you taking so much? So in India, I think there were some rumors, I read it, maybe I'm wrong, and maybe the information which came to me wrong, that people use different animals and their waste and their excreted material to treat COVID or maybe prevent COVID. So I don't know, how do they do it, and how do they spread it, and how do they respond? So it can be different parts of the
It's
world.
again
different-
cultural
different-
context. It's the
Yes,
cultural
cultural context has to be
those
put into
values at the
perspective.
local level.
It has to be put into perspective. Yes.
Absolutely. Brilliant. Kelly, any question in the chat box, or any participant wants to go live for questions, please? We can take one last question.
We don't have any on the chat box. I've kept
So it
them.
is time to conclude.
Yes.
So as session chair, I again would take it as my privilege and an honor to have chaired a very interactive discourse and a debate, triggering around a very challenging, subject of our times, the social media, how social media, both the volume and speed of disinformation, misinformation, malinformation, that really takes control of the situation, particularly during crises, emergencies, disasters. The bluff merchants, they waste not a split of second to take control of the situation, come up with their versions, and as already stated, organizations, be they public or private, don't have the luxury of time. They have to wage a war on disinformation, as the other side wages a war on truth. The leadership, be the public or private organizations or state or the governments or the relevant departments, they have to develop one, that they have to educate citizens, what they're calling media and information literacy. It is an ongoing exercise. They should take their responsibility to educate citizens about the demerits and flip side of social media, as to how some elements might trigger disinformation for their financial gains, for their personal identities, for their ideological and political reasons. At the same time, state and governments and departments need to put in place resilient, responsible, reliable, and robust internal communication systems, which have the capacity and capability to counter disinformation as and when it triggers off through social media. With these concluding remarks from my side, I would thank all the learned speakers, distinguished participants from different parts of the world, and above all, ADN and Dr. Nivedita, and our support team, Kelly, and the crew working behind the curtain to make this webinar truly a fascinating experience for all of us. So with this concluding remarks, I take Eddie, or I say goodbye to everyone joining us at this afternoon here in UK. Thank you very much.
Thank you.
Thank you.
Bye, everyone.